Want to thank you for listening in today. We are unusual in that we guarantee every one of our clients growth in new patient volumes through our marketing programs. And it's a very easy way to do it, that we do it. We actually bring the healthcare providers into the online and offline conversations that healthcare consumers are already having, and that in itself is enough to grow medical practices. We do it in rather sophisticated and complex ways, but the bottom line is patient education and patient communication. Now, I'll turn it back to Stephanie, who I think has some questions here that some of you have sent in.
Okay, so I'm going to start with the questions regarding how to respond to bad reviews, both kind of a how-to as well as what should be included in that response to the negative reviews, as well as a follow-up question of should you respond to the positive reviews? Okay,
so the first question was what should you say to bad reviews, and should you also respond to positive reviews? Is that right?
Right.
Okay. Well, what you say about bad reviews is completely dependent, of course, on what the review says. In most cases, 4 out of 5 times, it'll be about customer service. The easiest response to give, I think, is what you describe, dear reviewer, is not what we aspire to at this practice. And that's not saying that the reviewer is correct or even that the reviewer is a patient of the practice. Footnote for HIPAA concerns. But rather to say that if someone describes a bad experience, that you as a practice are concerned to hear that, and you are working and will work harder on ways to prevent those kinds of bad experiences. And of course, as I say, it's usually about things that are rather easy to fix, parking or the cordiality of the person at the reception desk and so on. So that's how you handle bad reviews, and I think it takes a little bit of time and consideration given to each bad review to really develop a good response. Good reviews, I think, should probably be left alone. No response is needed, and it's a little awkward actually to say anything in response. It seems a little less than humbling to say, thank you, yes, we are great. So I think leaving the good reviews as is a good policy. Every now and then, if somebody says something really unusual or noteworthy, not a bad idea to thank them for it and show some humility and gratitude for their comments. But otherwise, if you say thanks for every good review, I think it tends to become a little bit of a disincentive for patients to continue reviewing.
There was also a question of, are there any other HIPAA concerns to consider when responding to reviews?
Well, the main one, obviously, is to not disclose any information that may be associated with the reviewer, any personal information. As the HIPAA office calls it, protected health information, PHI. You just want to be very careful not even to suggest that you're acknowledging this person is real and is a patient. And sometimes they're not real. We have seen quite a few cases over the years where in fiercely competitive medical markets, we call them markets, cities, locations, where specialists particularly are duking it out for patients, there have been reviews that were questionable in whether they were really posted by actual patients or they were posted by competitors of our clients' practices. So I think that the main point here is to avoid anything that suggests that you are disclosing any kind of personal information about that person and to speak broadly about policies. Now, one good way to do that is if somebody really has a comment about his or her treatment or something that would venture into the territory of personal information, then the easy solution is to simply post a comment that says, we're very concerned to hear about your experience. We invite you to call us at our practice. Here's the number, so we can determine whether you are actually a patient and see if we can resolve your problem, something to that extent. And if you go by those general guidelines, I think you'll be pretty safe.
In those type of responses, can you come up with kind of a standard response that you just post each time, or is it really important to personalize the message each time you post a response?
I think it's incumbent to have some personalization. However, it doesn't have to be a work of poetry in every case. If you have a sort of scenario of 3 or 4 or 5 typical responses drafted in advance, then you can work off that and alter those in each case. One reason to alter them a little bit is that some websites are closely monitored by humans, and they may not post your response if it's a boilerplate, if it's a template that's already been posted once before. And the most notable one for this, of course, is Yelp.com. So some customization is good. You want to make it look like something more than an automated robot on the internet generating these responses.
And one person's asking, it seems that the majority of reputation problems that you see online refer mainly back to bedside manner, staff interaction, and the like. So wouldn't it just be better to address the issues within the practice as opposed to actually going online to reply to reviews and manage it that way?
Well, I think it's best to deal with them in both arenas. Definitely dealing with them within the practice is going to ultimately get you better customer service and better reviews. However, remember that when someone says something on the internet, it's out there on the internet, and it's typically there for theoretically infinity. So leaving it there unresponded to says to everyone else who sees those comments that you're indifferent or not paying attention. And I don't think that's the fastest way or a good way at all to building good online reputation.
You mentioned that, these reviews are kind of out there for everyone to see, and you also mentioned that Yelp can be troublesome for some of these practices and doctors. So one user is asking, why can't we just delete our Yelp so that it doesn't show those negative reviews anymore?
Because a patient can then go back and recreate an identity on Yelp in its place. Yelp is the 800-pound gorilla. Yelp has been the center of controversy for several years now because of their practices, including this rather interesting system of recommending and non-recommending certain reviews. If you're a frequent Yelp user, you're more likely to have your reviews posted in the recommended section on the Yelp website. If you've not been on Yelp before, this is your first review, chances are your review is going to go onto a different page that's a little hard to find on Yelp for any particular business. And on that page, it will be flagged as non-recommended review. And that's because Yelp has this philosophy, and it's pretty defensible, that more frequently you use Yelp, the more likely you are to be a real person and a real unbiased and seasoned reviewer. Now, that's in theory. I think in practice, it's unfair to punish people who are just getting started with Yelp by not showing their reviews, and most unfairly to many of our physician clients, a lot of the really good reviews are not in the recommended section, are not easily found by anybody visiting Yelp, and that's just not just. It's just not right. But that's the way it is out there. So it's a great idea to encourage reviews as much as you can, and to keep your Yelp account open. Try not to discourage people from using it, and certainly don't try to delete an account, because I think it speaks poorly of you in case somebody sees the account before it's deleted and then comes back later and find it's been taken down. In fact, I'm not sure you can take it down.
And that's actually a really great answer to one of the other questions of why does Yelp filter and why are some of my positive reviews not showing, is based on how that user is interacting on Yelp in general. Another Yelp question is, will paying for a Yelp advertising account show more of my positive reviews?
That is a great question that no one outside of Yelp seems to have a definitive answer to. Yelp has a pretty good case that it does not. There are a lot of people who claim that it does, and sometimes I think there's an inference from those businesses that do advertise on Yelp that if they pay Yelp, they will be treated better by the way that their positive reviews are handled in either the recommended or non-recommended category. I don't have the answer. We generally recommend our clients have a good reason before considering advertising on Yelp. Yelp is just one of many, many, many places to advertise, and I don't think it's a good idea, if that's your sole reason to advertise, to buy a Yelp ad in hopes that you're going to get better treatment.
Okay, we're going to focus on some other questions in terms of management. One question was, how many hours a week should be dedicated to online reputation management, and who in my office should be the designated person who manages that, such as the practice administrator or the office manager?
Great question. I see this responsibility punted quite often to someone fairly low on the totem pole in medical practices, and I don't know that that's a great delegation decision. Conversely, practice managers and administrators don't really have the kind of time that's required, in larger practices especially, to handle this. So with some acknowledgement of self-interest, I believe the best of all worlds is to hire an outside consultant or a firm like ours or many, many others to handle it. Just being careful, though, not to simply buy software, but to buy a service in which you can verify that a person is actually handling it. For smaller practices, 1 or 2 or 3 physicians, maybe an hour a week, if that, is required. Larger practices containing several dozen physicians, it might take as much as 2 or 3 or 4 hours a week, but it's really quite erratic. It ebbs and flows. Some weeks there are no reviews, some weeks you're flooded with reviews. So it's not something you can set up as a regular weekly routine of any kind. I do think, though, in most cases, a good rule of thumb would be to allocate at least 1 hour a week. That's only 52 hours a year, including vacations and holidays. And if you take those out, we're really only talking about a 40-hour work week to handle this. Well, that sounds like a lot of time, doesn't it? Well, I want to say back to you, isn't your reputation your most precious commodity? That's the best thing a doctor has to offer to the public. So an hour a week is probably a good rule of thumb minimum. Larger practices a little bit more, obviously. And again, it will come and go depending on how much reviews and when you get them.
Another user is asking, when you search for my practice on Google, information about my practice appears on the right side of the search results, such as the location and our hours. How do I change that or affect that information?
Well, that's a little bit of a complex answer. I believe that webinar participant is asking about rich snippets, something that we know as rich snippets, where information is pulled from a website and displayed in the Google search results. That is something that takes a little bit of expertise on the website management side, and if you have a good website management firm or consultant, he or she or they will know how to structure your website so Google can find that information easily and display it in the search results.
And early in the presentation, you were talking about claiming Yelp profiles and Google accounts. What do you mean by claiming?
Okay, good question. Just a moment, more explanation on that. When you go to any of these review websites, you will typically see a little message in red or gray or a box out to the side that says, "Is this your business?" Very easy to see on Yelp is a good example. That's usually a link. When you click on it, it opens up a new window or goes to another window in your browser. And there you will find some questions and an opportunity for you to answer those questions online to essentially make the statement that this is your business and you're going to claim it now, meaning that you're going to answer the questions and establish your online identity on that website. That information is usually submitted immediately when you complete the questionnaire. Then it typically takes several days for someone at that website management company to come back to you and verify that you are that business. And they will often do it through making a phone call through the number you gave in answering those questions. Sometimes they will send a postcard as well. And of course, that is how they help prevent fraud, because you want the address that you list and the phone number you give in the questionnaire to beat the practice's true phone number. And if anyone tries to hijack that, which we've seen before, it will actually go to the hijacker's address rather than the true practice's address. I think we're running a little bit short of time here, so let's have one more question and then we'll wrap up.
Okay, probably the big weighted one is, do you think patients really do choose doctors based on online reviews?
Well, I know one patient who does, and it's me. Absolutely, I do know that. I faithfully go to the reviews when I need a new specialist. And it's not because I believe their goal in every one is true and accurate, but it's more of an indicator. You know, we don't want to gamble even $100 out on a dinner at a restaurant we haven't eaten at without checking out some of the reviews. We don't want to stay in a hotel or buy something on Amazon.com to see what other customers are saying about it. This is the same, I think, in online management, reputation management, and Rate Your Doctor websites. I am absolutely certain that a significant number of healthcare consumers out there rely on these, and that they will continue to do so in greater and greater numbers for the coming years.